The Mannin Line with Andy Wint. Manx Radio.
Faster, good afternoon. Welcome to Mannin Line on Manx Radio. Manx Care today. Chief Exec Teresa is here. And as a bonus, we got the Interim Chair, Sarah Pincher's on as well. So if you want to get in touch with Manx Care, could be specific, could be something in general. Bouquet, brickbat, whatever you want, text, email, call and WhatsApp. Email studio@manxradio.com, WhatsApp 166 177, same SMS number, and call 66 13 68. So, Faster Mike, good afternoon, Teresa Cope.
Good afternoon.
Good to see you. And with the Interim Chair, Sarah Pincher's with us as well. Hello. Good to see you. Obviously, interim at the moment. Do we know what the position is regarding Sarah and the position of Chair, Teresa? Any official word at all?
No official word. The recruitment process for the new Chair for Manx Care has concluded. It is led by the DHSC, and I think an announcement will be made in due course.
Okay. And just a little bit about yourself, Sarah, if you would, to the Manx public.
So I'm been visiting the island for about 18 years. My husband is a very proud man from Onken, and I joined the board 3 years ago when we were in shadow form. I'm a corporate communications professional by background. I've served on a number of large boards in England, including the Health and Safety Executive, and I chair a charity called the Taylor Bennett Foundation, which supports ethnically diverse young people into careers in corporate affairs.
Okay. Now, lots to talk about today, including recruitment, retention and things like that. But first of all, let's go to the lines. And Julian's first on with us. Hi, Julian. You're live with Manx Care.
Hi, Andy, and hello to your guests.
Hello there. Hi, Julian.
Hiya. Just noting in the news this morning, Pfizer are closing their production facilities in New Jersey, North Carolina, Illinois, Colorado. It seems they've made a $6 billion loss recently, with their top-line products dropping by 42%. And this is following recent revelations that Pfizer's mRNA jab used a different and inferior production process than was used in the original clinical trial, and that simian virus SV40 was used in the production substrate to actually make the jabs, without disclosing that, which was pretty important to let people know. Based on what's going on with that, do you think it might be prudent to pause the booster campaign whilst these revelations are examined? Because there seems to be an awful lot of side effects going on, and it may well be due to contamination of the vials with this inferior purification process.
Teresa Cope?
Thanks, Julian. I mean, I'm not appraised of that news report this morning, but as you know, and we've talked about regularly, Manx Care, DHSC and Isle of Man government follow the JVCI guidance on vaccination. So I'm sure if there is new information which is relevant to that guidance, then that would be considered. But as you know, we follow strictly to JCVI. So I'm sure in due course that will be considered. Okay.
Julian, what's your view?
Well, yeah, it's interesting. I'm just wondering is there any mechanism at Manx Care where you can actually not listen to the JCVI and actually go and do a bit of our own research rather than waiting for how long that... Because it's quite a large bureaucratic process. But meanwhile, there are people that are getting jabs that... I mean, it's Health Canada, they were the ones that revealed that this monkey... virus SV40 was actually, they've been doing analysis of vials and finding this, and Pfizer have been forced to admit that they were using this, which was implicated in some nasty things happening some time ago with polio vaccines. So I'm just wondering, is there a way that we can separately just have a bit of look at proper research papers and just make our own mind up rather than waiting for a sort of a monumental bureaucratic process to maybe do something in a year's time?
Yeah, I understand that. And, essentially, it will always be an opportunity for us to consider whether we did deviate from that. But ultimately, that would be a decision which we would expect to be led by public health. So we would obviously contribute to those discussions. But, as Manx Care are sort of the delivery arm of the vaccination programme, it would be very much a debate and a discussion which we would expect our public health colleagues in conjunction with the Department of Health and Social Care to very much lead. I'm not trying to dodge the question. I'm just trying to sort of say who would probably be best placed to initiate that level of discussion and perhaps consider that deviation away from JVCI. It certainly wouldn't be Manx Care. We obviously contribute to that overall piece, but it wouldn't be our piece to...
Okay. All right. Thanks, Julian.
Thanks, Andy.
All right, yeah, it's good to hear from you. And on that, where does Manx Care sit regarding the DHSC? Where do you sit in terms of what's political and what's operational?
So we're very much about delivering against the mandate which is issued to us from the Department of Health and Social Care. So we are non-political, we are at arm's length. Obviously we work very, very closely with the Department of Health and Social Care, and we make sure we are very aligned on all of those agendas. But we are very much the sort of operational delivery, the professionals within the service, responding to the mandate. Okay,
let's bring on Vivian now. Hi, Vivian. You're live with Manx Care.
Hello, Andy. Hello, Teresa.
Hello, Vivian.
Can I pass on a compliment? I'm not the greatest person of compliments, but I went to the new clinic at Ramsey Group Practice last week, the Fragility Clinic.
The Frailty Clinic.
You know all about this, do you?
Yes, the Frailty Clinic.
Yes, and all I can say is it's absolutely wonderful. I got a 3-page letter yesterday telling me all we discussed and everything else, and I would just say it's one thing that I would recommend to anybody if they get the opportunity to go.
In what way did it help you, Vivian?
Well, it was about 3/4 an hour to an hour, and you sat and talked to 3 specialists and a care navigator, and there was a consultant, a pharmaceutical, and nothing to do with any of them on the island, and an advanced clinical practitioner. And you discussed all that's wrong with you. They showed me MRI scans, which I'd never seen, which was quite an eye-opener. And just talk generally about your problems, about your medication, everything else. And it was wonderful.
Okay, all right, Vivian, we're happy to pass that along. Thanks for calling today.
That's all right. Bye.
Okay, what it's called the Frailty Clinic.
It is, and it's part of a new initiative around out-of-hospital care. Manx Care has really invested in the Frailty programme, and it is led by a team including a consultant geriatrician, advanced nurse practitioners, who obviously Vivian has seen, pharmacists, and it is a sort of a comprehensive assessment around all the holistic aspects of care when you're getting older, you're on multiple medications, adaptations may be needed to the home. It is about, a very holistic level of care planning to keep people well and keep people out of hospital.
Is this replacing anything, or is it new?
No, it's a whole new service. So we took a decision last year to invest in a frailty programme. Some of that is in hospital, and Ward 6 is now our frailty unit for those patients that do need to come into hospital. But we've also got a lot of provision out in the community. We've got a GP with special interest working in this service as well. So it is about that advanced offer to people.
Okay, Anne's with us now. Hi, Anne. You're live with Manx Care.
Afternoon. I'd just like to ask what the policy is on diagnosing historic injuries that have not yet been diagnosed.
historic injuries not yet diagnosed. Could you give us a bit more detail, Anne?
Well, broken bones that aren't on medical records, things like this. But clear broken bones, that when you get the x-ray out, there's broken bones. But health service refused to put them on records.
Okay.
It sounds like, Anne, this is a very specific matter to yourself, so I'm probably happy to pick that up offline. I mean, obviously, if previous fractures are identified, they would get treated in the normal way. I'm not quite clear what has happened in your case, but very, very happy to speak to you directly after the show, and we can pick that up.
Okay, Anne, if you we'll take your telephone number, and Teresa will give you a call if that's okay.
Oh, that's fantastic. Thank you.
Thank you,
Okay,
Anne.
all right. Thanks for calling today. A message now. This is texter 252. When's Summerhill View going to be completed?
Probably during the early part of next calendar year. So we were scheduled to have Summerhill View completed from a building perspective around now. That has been pushed out, sadly, and I think we're looking at January, February next year.
Certainly before Easter.
I think the building will be completed before Easter, and then there's all the sort of internal refit and the furnishings and all the things that Manx Care needs to do to prepare that facility to open. So I think realistically we are looking for May, June time before it's sort of occupied with residents.
Okay, and Juan's with us now. We've got Juan live on Mannin Line. Hi, Juan, you're live with Manx Care.
Hey, good afternoon, Andy. Good afternoon, Teresa.
Good afternoon, Juan.
Hi. Yes, I had a few points. Following up on what I spoke about last week, which was released on September the 13th by the Surgeon General in Florida, was to all care providers, advising care providers not to take COVID boosters under 65 years old. Infection not found in other vaccines, risk of subclinical and clinical myocarditis and cardiovascular conditions, and with the protein from mRNA persist in some individuals for some time that may carry health risks. Now, going along with
Juan, I'm sorry. Juan, I'm sorry. Your mobile signal's deviating here and there. What was the specific question?
Can you hear me there, Andy, now?
You're better now, Juan, yeah.
Okay. Along with that that I just said, comments that was made by Esther McVeigh in the House of Commons recently, and also the Football Association in England have advised professional footballers now not to take any further COVID vaccine booster shots. So with all that information, going along with what Julian just said before, can you make a comment on the safety and effectiveness of these boosters and vaccinations going forward?
Okay.
I think it's the same answer that I gave earlier.
I mean, first of all, they're not mandatory, are they? They're not compulsory.
They're not. It's entirely for people to make that decision as to whether they would want to take the vaccine or not. We do and are and have always followed JCVI guidance, so that sort of national guidance which governs vaccine.
For the uninitiated, JCVI
it's the Joint Committee for Vaccination, and that's across both the NHS in the UK, and we adopt that guidance. Again, we have always followed that guidance. If we was to deviate from that, I think that would be something initiated by public health, either public health in the UK under the UK HSA, or indeed on the island here. But I think it's the same response that we would be taking the lead from public health and what they were saying.
Okay. All right. Thanks, Joan. I'm sorry that your signal's going here, there and everywhere. A note in from D on 761. My wife and I have been in receipt of DLA, which is... DLA is... disabled living allowance, perhaps?
Possibly.
For several years we've tried to get a carer, but nobody's interested, as the allowance is less than the minimum wage, so we have to rely on family and friends for help and support. We recently had a relative apply for carer's allowance, but he was refused because he's in gainful employment. If Manx Care want people to stay in their own homes as long as possible, then surely the rule needs changing. If you can't do it, then you should advise the person who can do it, because that we're saving the care service a lot of money. Did you get that?
I did, and that is very much understood. We know there is a huge amount of unpaid carers in our system. The Department of Health and Social Care is developing a carers strategy in order to be able to identify and assess the needs of carers in our system. But also we know the DHSC are leading a piece of work around what does that care provision look like, the equity of care provision, that social security, social care aspect, which we know is needs a level of reform here. So the Department of Health and Social Care are leading that with the contribution from Manx Care, but we absolutely understand that there is a lot of unmet need here. There is a lot of carers who require that assessment and support, and we know the burden on health and care would be significantly higher if we didn't have these carers in our systems.
Okay, now an all-encompassing one, let me adjust this and make a sweeping generalisation. How are the waiting lists going, this one says?
The waiting lists are generally moving in a positive direction. So, we know we've talked about restoration and recovery and the importance of trying to get the waiting lists under control. And it is very much dependent on specialties. Some specialties have a very high demand and need extra investment in order to respond to that. Some we've got a very clear plan for. So if I just give you some headlines, Andy, we've talked a lot about ophthalmology, and we inherited a waiting list for ophthalmology of cataract surgery of over 3,000. That waiting list is now below 300. That waiting list has reduced by 80%, and that is now business as usual.
I got a note in from 835 on a previous appearance. Teresa Cope stated 2 consultants have been appointed. Is that so?
That's right, yes.
So 2 consultants to ophthalmology?
Yes. One substantive and then one visiting who does regular sessions for us. So it is much more stable than what it was in the past. The waiting list reductions, overall we've delivered 3,000 extra procedures. Orthopaedics has reduced its waiting list by 40%. 740 radiological scans. So those are the sorts of things that we're seeing. So we're generally seeing a reduction in many of the waiting lists. But I think what we are seeing, which we talk about in all of our board papers, and is a real dilemma around the finances, is we are seeing some very high demand in some of our areas.
Okay, a message in from Peter, and if you could, this is again regarding waiting lists, skin cancer. Have you got any update on skin cancer?
So we work really hard with the dermatology team and the plastics team up at Ramsey. It's an excellent service. The CQC assessed that service and identified it was an exemplary, outstanding service. It's a very, very high demand service. There's a very high number of referrals that come through the 2-week wait service. We've currently got a visiting dermatologist and a very experienced team of clinical nurse specialists. It is one of the areas that we have struggled to recruit to a consultant. There are only 2 specialties, and we talked about this at board a couple of days ago, where we have not been able to recruit substantively to consultant posts, and dermatology is one and gastroenterology is the other. But we are working on a plan. We've also got the GPs with special interests. So these are the GPs we started training 2 years ago in order to undertake dermatology work. So the service does perform extremely well, but it is a very high volume, high demand service.
Roger. Hi, Roger. You're live with Manx Care.
Hi, good afternoon. Good afternoon, Teresa.
Hi, Roger.
Some help, please, if you can point me in the right direction. What my problem, in fact, it's both myself and my wife, is and I apologise if this has already been touched on, is the NHS, on the COVID booster, the most recent jab. I had mine at the beginning of October. My wife had hers about 10 days later. And it's a reoccurring issue that what we're unable to do is to actually get these confirmation of the jabs onto our NHS apps. We're both off Ireland at the end of this month, and we'd feel much more comfortable if we had them with us electronically. I rang 111 on a couple of occasions. They tell me that they've resent them, whatever their system is, and it comes back as failed each time. And finally, I'm not sure if there's a connection here, but my winter flu jab I had at a local pharmacy, Carson's, and that was on my NHS record within a day or two. But I had my COVID booster again at Chester Street, and my wife had her COVID booster at Chester Street, also her flu jab at Chester Street, and it's just coincidence that each time we have an immunisation there, we hit a brick wall, and we've eventually got there on the previous ones, but this one is just a complete obstacle, and I'd be grateful if you could point me in the right direction. I've tried ringing NHS UK direct, but there's so many automated calls, it just pushes me from one and press this, press that, and in the end it says goodbye. So sorry, if you could help me, I'd be extremely grateful.
Of course, Roger. So we'll definitely, if you leave your details, we'll make sure we look at that this afternoon. Just for future reference, if there are any issues, MCALS is always really helpful, 642 642, and they can help sort out any of these issues. But we'll certainly make sure that's uploaded and hopefully make sure that you can go away with some assurity at the end of the month.
Brilliant. And sorry, I just missed the build up to the 642 642. Where was that, please?
That's MCALS. That's our Manx Advice and Liaison Service. So they can help signpost you or sort out any minor queries that you may have. So they would be able to assist you in just taking on that query, dealing with the vaccine service, and hopefully getting that uploaded for you. Okay.
Is that readily available? That
it
number?
is.
For me, that's the first time that I've been aware of that number.
Yeah, no, they're a really helpful team, and they'll take that query and hopefully get it resolved to you. We resolve about 90% of all queries to MCALS within the same day. So
okay, thanks, Roger.
Thank you for your time.
Good to hear from you. 642 642. That's MCALS. Live on Manx Radio. We're live with Teresa Cope, Chief Exec of Manx Care. Sarah Pinch's here, the interim chair.
Mike has got the conister feeling. Because despite his busy life, getting the finance to sort some home improvements was quicker and easier than he ever dreamt with Conister Bank.
You got me feeling good, got me feeling good, got me feeling good, got me feeling good, yeah!
Ooh, and not even Conister can help improve his singing. Apply online today at conisterbank.co.im and you'll get the Conister feeling too. All loans are subject to status. Terms and conditions apply. Early settlement fees apply.
Walk through the northern lights into a land of ice and snow at Ramsey Garden Centre. Indoor and outdoor lights, a magical range of real and artificial trees, decorations, gifts and much more. Christmas at Ramsey Garden Centre, Albert Road.
Here at the Ramsey Park Hotel, we're delighted to introduce our new executive head chef, Leslie Jacob. With a food philosophy of classic food combinations and flavours and his international experience, Chef Leslie excels in both New World cuisine and classical cooking, with the emphasis on great ingredients combined with skill and intelligence to delight diners. Call 818-123 to book the Lakeview restaurant at the Ramsey Park Hotel and discover seasonal specials, lunchtime offers, winter a la carte menu, Sunday roasts and more.
Get ready for another winning weekend on Manx Radio.
And this weekend, you can win an emergency first aid at work course plus a universal first aid kit from St John Ambulance. For training courses, room hire, or to find out how you can get involved, visit sja.org.im.
Visit manxradio.com and answer the competition question for your chance to win. You can enter as many times as you like.
Then make sure you join us on Monday morning for Manx Radio Breakfast when we'll announce the winner.
Make this your winning weekend with your nation station, Manx Radio.
The Mannin Line with Andy Wint.
Live with Manx Care today. It's 29 minutes before 1. And back to the lines. It is Julian. Actually, it's a different Julian. Hi, Julian.
A bit of a compliment and a bit of a question, if possible.
Okay.
First of all, we had a new baby arrival in the maternity suite around 2-3 weeks ago. And first of all, the compliment is great service, absolutely fantastic. However, I do have a question about the staffing there, and that's hopefully you might be able to answer. The reason for that question is it just seems incredibly understaffed. When we were there, we were talking to 2-3 midwives that were actually brought over from Guernsey and London, and they were, discussing their hours that they were working, etc. And we subsequently, because of the staffing issue there, missed the day 5 and day 10 appointments due to lack of staff. And each sort of time they say, and they call us to cancel those appointments, they say someone from Manx Care, the maternity ward, will call us back. But it's actually us that have actually had to call them to try and get the appointment. So essentially we have a child that has missed the day 5 and missed the day 10 due to this. I just wanted to know if there was a fundamental issue there.
Thank you so much for your call, and congratulations on your baby. I spent a couple of hours with the maternity service on Monday morning, and there is an issue. There is obviously a national and an international shortage of midwives, and we are not exempt from that on the island. We are doing everything we can through sponsorship of midwifery students, working with agency staff, which I think is the people you're referring to, that you spoke to as during your care, but also really trying to look at every single type of option that we can to strengthen that service. But it is an issue for the board. It was an issue that Teresa and I spent some substantial time talking about in terms of what else can we do. And we've actually asked the service only this week to go away and think about short term, medium term, long term. What are the additional things that we can do? I'm so sorry that you missed those appointments, and I think we would like to ensure that someone calls you. So again, Andy, if it's okay if we could take the contact details and make sure that someone from the service gets back to you.
What did they say when you called them, Julian?
It was straight to, I don't want to cause issues, but it was a case of that they didn't have any staff available to take those appointments. And I think that was basically when we were delivering, there was a couple of emergencies that came in. Obviously, they need to direct their staff to those. We're fully aware of that. But to miss 2 appointments like that due to staffing issues and not get that call back, I just wanted to know, you've obviously answered the question that there is an issue there, but I wanted to know if anyone else has had that as well. But essentially it was down to lack of staff. Okay,
how's the child?
Yeah, brilliant. We did have one issue that we had to come back to the hospital with, but again, the compliment there is, the fantastic service. They are overstretched and overworked, but yeah, it's been exemplary.
Okay, all the best. Hope you get plenty of sleep.
What sleep?
All right, thanks for calling. All the best. Good to hear from you. Carol's with us now. Hi, Carol.
Hi, Andy. Hi, Teresa.
Hi, Carol.
It's just a couple of questions, if that's okay. One is about the transformation team. We don't hear very much about the goings-on behind the scenes with Manx Care transforming to the new mode of delivering healthcare. Particularly interested in the medical records side of it and how that's going in terms of sharing medical records with the island and with the Northwest. I have talked to lots of people who seem to be asked the same questions over and over again by various medical personnel, and there doesn't seem to be any evidence of them actually reading up on the notes on the people that they're seeing. And the second question is, the ophthalmic department are sending home people of a certain age, of the older population, having had laser surgery, with prescriptions that they have to get, which the pharmacists don't have, and they're told they have to have these drops because of the danger of the laser treatment causing internal swelling. So it's quite a worry for the elderly people who have to rush around all the pharmacists to find out if they've actually got these drops, and the hospital pharmacist won't dispense them because it's the wrong coloured prescription.
Which drops are they?
They're drops that go into the eyes once they've had laser. They have a laser treatment, which enables it's post. I can't remember the particular situation, but it's drops they're given to reduce the swelling after the laser treatment.
And cataract surgery, is that?
Yeah.
After cataract surgery, Carol. Okay. Well, I'll need to pick up on that one because I wasn't aware we had a particular shortage around those drops, or there's a particular supply issue, which I'll pick up offline and again come back to you. With regards to the transformation programme, a number of those strands of the transformation programme, of those 26 recommendations initially approved, they are still progressing. Some of them were deliberately paused just over 12 months ago because of the funding situation. So some of the work on care pathways had to be paused. Some did continue. So things like primary care at scale and developing our out-of-hospital offer, intermediate care, see and treat with the ambulance services, all those things continued. But some of the in-hospital care pathway work did pause. And remains on pause. I think what you're referring to when is you talk about the electronic patient record, the Manx Care record as we've come to know it. And that piece of work is still being actively led by the transformation team. We are still working through the funding approvals for that with both the department and with Treasury. But it is still an active piece of work. But I think we're all a little bit frustrated. It's probably not moving as quickly as we would like. And I know our clinicians are particularly concerned that we're not making enough progress on what is a really, really important step forward for Island Health and Care. That single integrated healthcare record is so incredibly important for us.
Is it a tech issue, money, or
it's a bit of both. I mean, I think it's a very complicated procurement which needs a very detailed specification because you're trying to look for a solution which fits an integrated health and care system. But fundamentally, it is around money.
Okay, all right, thanks. Sorry, Carol, go on.
I just wanted to make sure you avoided a big mistake of spending an awful lot of money on an electronic system that isn't fit for purpose, which is very common in the UK, particularly to do with medical care. So, I'll be interested to see how far that goes.
And just to add to that, Carol, we sort of recognise that, and we recognise how important those connections are, both within the island system, but also to the partners in the Northwest who we work with, those tertiary partners. So we are linked with Liverpool because they are also going through a procurement for electronic patient records. So we are making sure we are aligned in that.
Okay, thanks, Carol. Good to hear from you. We'll just pause for a moment on calls because I just want to talk about, the Minister talked about recruitment, retention and the overspend. So which bit first would you like to look at?
Or the underfunding, Andy, is what we sometimes like to refer to it as. No, I mean, in all seriousness, if I come to recruitment first, Manx Care was established with a very clear aim of delivering against the 26 recommendations for Sir Jonathan Michaels. And I've talked about the real progress we have made around consultant recruitment, the new services like Frailty, like the long COVID service, intermediate care, ambulatory care, a new sexual health service. All of those have required investment. And we are committed to delivering that. We, as I say, we have always been able to recruit into all the consultant posts that we have advertised, with the exception of dermatology and gastroenterology. We are interviewing tomorrow for 4 consultant anaesthetists. We are interviewing later in the month for cardiologists. And I think that has set us on a direction of travel where we've needed to invest. And then when the transformation funding has ended, we have needed to pick up the recurrent costs of those new services. So if I just talk about the money a little bit, Manx Care were given £308 million for this year. And we are forecasting to overspend. So we're forecasting to spend £330 million. If the Sir Jonathan Michaels funding formula had been applied consistently, Manx Care would have received £363 million this year. So sort of £55 million more we would have. So we wouldn't have had an overspend. We would be underspending. And I just want to explain, I think it's really important to sort of justify and explain where this overspend is coming from. So of that sort of 26 to 30 million, which we're talking about in terms of the overspend position, £9 million worth of that relates to giving a pay award to our staff. Non-pay costs, these are things like inflationary costs on contracts, drugs, consumables. That is taking a further £7.3 million. £4.7 million is relating to additional staff costs. So this is the impact, the longer term impact of pay awards, and also things like, recruitment, retention, additional posts that we've had to put in. And then £3.8 million is relating purely to new services that Manx Care has developed. Investment in our safeguarding team, the frailty service, the long COVID service, the diabetes service, eye care transformation. So all of those things. And we have invested in safe staffing levels. So we put £500,000 into safe staffing into the emergency department over a 2-year period. We have increased the number of nurses that we are training at Kildare and increased the bursary. So all of this is the reason for that extra cost in the system, but we feel it's absolutely necessary to deliver a high quality and safe health and care system and respond to some of the things that the CQC and Ofsted have said. So whilst we are overspent and we take our financial responsibilities really, really seriously, I think we can justify the position we are in, and we are absolutely committed to scrutinise our finances going forward.
Okay, just two questions. They're from Marilyn. Just said, is the industrial action now completely over? And also, how can you lessen the churn factor, or retaining staff? How do you do that?
Good points. Yeah, good points. So the industrial action at the moment is paused. We had some very productive discussions with our staff side, and particularly the Royal College of Nursing, who had taken industrial action, and we have been able to put a revised offer on the table. The RCN now need to ballot their members on that. And we should have an outcome in the next couple of weeks. But the RCN have taken the decision to pause any further industrial action whilst they undertake that balloting. And I think, I'm grateful to the support from the Department of Health and Social Care and Treasury and able to put that revised offer on the table, because this was money Manx Care did not have in its baseline. So yes, I think that's where we are.
Retention. How can you lessen the churn, as it were?
It's a really good point, and it's always multifactorial. It's primarily it's about having good career options for people when they come, being able to train people to a really high standard, get good job satisfaction. The culture of the organisation in which they work is one of the biggest things that we can do to make people feel valued, supported, and a great place to live and work. We've talked on here before, haven't we, about the importance and the cost of living and all those associated things outside of Manx Care which are important, things like affordable housing, the ability to generate networks, good childcare, good schools. Those are all the things which help us retain people here on the island. But a decent pay award is ultimately, with a cost of living crisis, what really matters to people, and all those things need to stack up for individuals. They need to feel they have good career prospects here, high job satisfaction, and they can live and afford to live here and live well.
I know that you feel quite strongly about a positive culture within work, and you want people who work in the hospital, whether it's Ramsey or elsewhere, whether it's adult care, which you want everybody to feel happy about coming into work. How far are you down that line?
I think we've made quite a bit of progress over the last 2 years. Culture is something which you just have to keep working at, and it has to always remain a real priority. We have to keep looking at developing those new initiatives. As you know, we published our People, Culture and Engagement Strategy last month. That's now a 3-year plan, recognising the importance of valuing and caring for our staff well-being, making sure we are inclusive as an organisation, that we've done sufficient workforce planning and training and given people the skills. You know, there is always more to do, and I think we recognise that there's a lot to do to get that consistent approach across the organisation, but it's something we're really committed to.
I mean, on a personal level, how do you cope with the naysayers? How do you cope with the people who are consistently snapping at your ankles where things like this are concerned?
You know, I think we always have to listen to those people's views, because those people's views are just as important as the people who are basically telling us how things feel so much better and so much different. And it's been really, really positive. And I hear that a lot, you know, as much as I will hear and I want to hear the people who are not having a good experience of working in Manx Care. I also hear lots and lots of positive feedback from people saying we are doing the right things. We can see a difference, and people recognising this doesn't happen overnight. You know, it takes time.
The really important bit is the listening part, and I think, you know, as a board, particularly as non-exec directors, so we are not working directly on the business. We have the ability to take that larger view and to be available to staff. And you know, we spent an hour and a half with a group of staff yesterday just listening to their experiences, and you know, it takes time, doesn't it? And I'm no football fan, so don't ask me any questions subsequent to this statement. But, you know, Sir Alex Ferguson said, give me 13 years to improve the culture at Manchester United. And it took a long time. You know, we're kind of going into our 3rd year. And I think, as Teresa said, we've made good progress in some areas. But there clearly is more to do. And we are very committed to doing that and very committed to listening.
OK, I won't ask you how Ole Gunnar Solskjaer did as a manager then.
See, I'm lost already, Andy.
12 minutes to 1 on Mannin Line.
It's good to talk. It's how we get things done. So when you apply for a personal loan from Black Horse, you'll get support from one of our relationship managers who's there to talk you through your application. You could borrow up to £50,000 with up to 7 years to pay it back, and you could receive your money within 24 hours of approval. Ready to talk? Go to blackhorseoffshore.co.uk to request a call back today. Finance subject to status. Applicants must be 18 or over.
Island Hearing Limited, your local hearing care specialist since 2009, with branches in Port Erin and Ramsey. We provide the very latest hearing aid technology available, which you can try at home, with excellent aftercare and a wax removal service available using microsuction. Give us a ring on 830 722 or visit Island Hearing at One Station Road, Port Erin. We're happy to help. Island Hearing, always listening.
Do you know a scrap man? 'Cause I've got scrap to clear. Causing copper, brass and lead, and I need cash for beer.
What? You don't know a scrap man? Gastains of Foxhall is the one for you. Gastains will take all scrap metal and is also licensed for dry cell and lead acid batteries. So don't delay. Ring 801 337 now.
So now we know a scrap man and all our scrap's been cleared. Ring 801 337, then have cash for beer. Call cost dice today and get yourself a beer.
Does bonfire night still go off with a bang? Or, in these more health and safety conscious times, is it a bit of a damp squib? Join me, H, as I ponder old claims. Can we rekindle our love affair with bonfires? Or have their glory days gone up in smoke? Whatever happened to bonfire night? Tomorrow, just after 6, here on Manx Radio. Then available as a podcast via the Manx Radio website. Dare I say it? It's a cracker.
The Mannin Line with Andy Wint.
10 to 1 and Stephen. Hello, Stephen. You're live with Manx Care.
Hello, Manx Care. Hello, Andy, and hello, listeners. I wonder, could I just ask 3 short questions, and with some answers. The first one is, I noticed that you've said a few times, Teresa, when you've been on, to ring me later, and we'll try and resolve the problem. So that to me tells it sort of signifies to me that if you weren't on, how would these people contact the relevant department to express their problems? So we can't rely on you coming back onto the Mannin Line regularly to hear these things and resolve them. Surely there should be a better way that can be done. The second point is, have we made any progress with the current home in Peel? Because I do know some people this week who would have really benefited from the respite care that they gave. And the third point is, I think I did ask you this last time, so you can recap if that's helpful, is as the population of the island increases, then surely you would need a bigger budget. The same budget can't be used each year. Sometimes there's more specialities, more drugs, but essentially, if we get a bigger population, then surely you deserve and would need a bigger budget. So there's my little 3 points, please.
Thank you. So, Stephen, MCALs, and if you was hearing us earlier on, we talked about MCALs. So the number is 642 642. MCALs can sort out any queries, and if it's sort of more serious and needs to be dealt with the complaints process, I will push it straight through into that process. But if it's a sort of a query, a question, MCALs will take that query and deal with it, and they deal with about 90% within 24 hours, so they're very responsive. The Corrin home, I mean, that would be a matter for the Department of Health and Social Care broadly. Manx Care delivers services. I do recognise that there is an absence of residential provision in the West as a result of the closure of Corrin home, but that really is a matter for the Department of Health and Social Care. And budget and population growth, yes, absolutely, definitely. If we was to have more people on island, that would increase the level of demand and provision needed. We would need to expand our services accordingly. We would need to understand the demographic of that population growth in order to work out exactly what was needed. But, all would need a GP, all would need a dentist, all would need to be able to be catered for with from an emergency department perspective. So yes, and I think this comes down to the difficulty we're having around the budget, because we want to respond to things like this, the Care Quality Commission and Ofsted, and make sure we are providing the highest quality of services for the island's population. But unfortunately, that does come at a cost, and hence the reason why we are in an overspend position or an underfunded position, whichever way you choose to look at it. And I think I spent the last 5 minutes sort of just trying to describe at least and justify where we have spent the money, which has resulted in that overspend position.
What's your particular point, Stephen? What do you think should happen to the Corrin home?
Well, I would hope that there would be some discussion between the trustees of the Corrin Memorial Trust and the department to try and move some way forward. We've had no progress made for a number of years now, and I think it is detrimental to the people of Peel and the West. And I also think, just to add to that problem, that there is a cost to the idea of increasing the island's population. And I just wonder, has these costs been factored into the desire to increase the island's population?
OK, all right, we've got to dash on because we've got lots of queries to come in. Stephen, thanks for that. Here's a question in from Nadine, who just said, does Manx Care have any opinion about the proposed assisted dying bill? Manx Care as an organisation at arm's length has remained very neutral on this, and I think that's at the point where the bill is passed, ultimately the Department of Health and Social Care will potentially mandate Manx Care to deliver certain aspects of that, but as an organisation it's important we remain neutral. Okay, so it's basically politics first, and then whatever flows from that will happen. Yeah. Okay. Also, here's a question in from Henry, just regarding dentists. Horrendous delays for NHS dentists. What is the current state of recruitment and provision?
Yeah, so we have, and we talk about this quite a lot at our board because it is one of our biggest risks in that we know it is very difficult to recruit and retain dentists, and we have a contracted model which is currently not delivering a full service for all of the patients who require a dentist. So the waiting list has grown again and is around 4,500. It's part of the reason why there needs to be a much broader set of reform around dental provision, and it's one of the reasons why Manx Care is going to run Hillside Dental Service from the 1st of December in order to protect the provision of dental services for those sort of 6,500 patients who are registered with Hillside. It is really, really tricky. We went out to adverts last Friday for dentists, actively trying to recruit to dentists, and also looking, we had a meeting about it this morning, trying to look at potentially international recruitment for dentists, but it is not a quick process, and again it's another specialty which is very much in demand, and there are national shortages of.
Okay. Well, there was so much more we could talk about, so how about you pop back before Christmas? Would that
Definitely.
be okay? All right.
Happy to.
Lots of things we didn't get to talk about, like the training of doctors, and also other questions in regarding, we had gastro, more on ophthalmology as well. Synaptics. Oh, just you can tell me very quickly. A lady said, is that very good Scottish team of surgeons going to stay with us?
They will stay with us for a time being, but this was all extra money in the system, so possibly not in the scale they have been.
Okay. Thanks for being with us today. Thank you, Sarah.
Thank you.
Good to be with you today. That's Mannin Line Manx Care today.
WINT